Good afternoon, ladies and gentlemen. Welcome once again to Cleavy's Learning Center, your nursing assistant training class. Um, so, um, First of all, we're going to discuss healthcare delivery because in order to become actively involved in healthcare, you need to understand its history, its past, its present, and purpose, and the different types of organization affiliated with healthcare. So, without further ado, I want you to open your book to page 3 of chapter 1. Okay, and we're gonna start with the healthcare delivery system. Okay, now healthcare delivery in the past has primarily focused around the home and the family, and the healthcare provider, meaning the doctor, was primarily trained in general skills, okay, general healthcare skills. And the doctors did home visit. What does that mean? Basically, that means that there were very few hospitals, and it was at the time a little more convenient for the doctor to go and do a home visits, okay? And the training that they had back then basically was focused on general skills. So the doctor was not specialized. So that means your family doctor was your OBGYN, your cardiologist, your pulmonologist. So they would do everything, okay? But today, it's a little bit different. I should say a lot different because today doctors, they spend a lot more time in school. They have a lot more education. They study specific branches. They specialize in such thing as OBGYN, cardiologist, pulmonologist, etc. So they they specialize in specific branches, okay? And the care is not so much provided in the home, meaning doctors don't do much home visits anymore because it's more convenient to have it done in the hospitals where you have all your equipment, okay, and the patients can come to you by the many. And there's also doctors' offices where the client would go and receive care, clinics, etc. Okay. And today we focus on something called holistic care. Holistic care basically means care of the person by many disciplines. So that means that you have different disciplines coming together to provide the care. So that would mean your primary care physician is working side by side with, say, your cardiologist. If you have heart problem, they would be working with your dietitian. If your diet needs to be modified because of your diagnosis, they would be working close with whatever other discipline, even physical therapy. All of those disciplines would be involved. So all those disciplines working together provide holistic care. You have different types of healthcare organizations, okay? Basically, that means there are different places providing healthcare, and each organization have their own mission, their own purpose, their own reason for being around, okay? And they all do provide patient care. However, they have specialties, okay? So for example, the hospitals provide acute care to the patient. So that means if the patient is acutely ill, they have a life-threatening emergency, the hospitals would be more equipped to take care of that, okay? So their purpose would be to provide acute care. You have subacute care units, long-term care facilities such as the nursing homes, and these types of facilities, they provide the type of care that is needed when the patient finish with the hospital, they get discharged from the hospital, and now they're not doing well enough to go home. They need more care, but they don't really need to be in the hospital. All right? And each types of hospital have different mission. Understand, each type of facility have different mission. So for example, Children's Hospital, their mission would be to treat children, right? Dana-Farber Cancer Institute, their mission would be to treat cancer, right? So in the hospital, the client is called a patient because they're just passing through. They're there to receive the care, okay? And then move on. In the nursing home or the subacute care facility, the person is known as the resident because they live there either permanently or temporarily, okay? And let me mention that the long-term care facility, these are for the people that can no longer go home because they need continued care. They can no longer function on their own. Other facilities are assisted living facilities. These are the type of facilities where the person is called a client, first of all, and they need a little bit of help. They need a little bit of help. So they can do most of it by themselves, so they don't really need to be in a nursing home. So assisted living facility, and you also have the home health care agencies. These are for the patients that decide, you know what, I want to stay home and receive all my care at home. All right, and that's perfectly okay. In those two types of environment, the person is called a client. Okay, not a patient, not a resident, but a client. Okay, and there's also another type of organization called the hospice. Okay, the hospice organization provide care to patient, resident, or clients and their families. Now, these are for patients that are dying. All right, so hospice provide care to the dying client. Okay, all right, and there are lots of misconceptions about hospice because a lot of people think hospice kills people, but the fact of the matter is they provide care to the person who's already dying. So they make the transition a lot easier for the client and their families. All right, now let's take a quick look at the structure of the healthcare system. Okay, in just about every facility that you go to, whether it's a nursing home or a hospital, they are well structured because that's how it has to be in order for it to run smoothly. You have board of trustees or the board of owners. It could be owned by one person or an organization. You have the administrator or the CEO, the people that run, the person that is responsible for the day-to-day operation of the organization. There's the medical staff, which includes the doctors, the nurse practitioners. You have the director of nursing. They handle the nursing department, everything that has to do with nursing, nursing assistant, and nurses. Directors of ancillary services, such as housekeeping, maintenance, kitchen, business, director of business. This department is responsible for hiring, firing, processing employee paperwork, and other facility services. Okay? All right. Now, all of these departments, we call them the healthcare team. Okay? All of these departments, they form the healthcare team, and all of them focus on the resident, patient, or client. So you have to remember who exactly we're working for. We are working for the patient. So all those departments, the kitchen works for the patient. Who do they cook for? The housekeeping. Who do they work for? The patient. Nursing, medical, all of them, pharmacy, lab, everyone are focused on the care of the patient. Okay? Now you gotta realize that healthcare, these organizations are in business. They are in business, and businesses are created to make money. Okay. However, the United States Department of Public Health, also known as DPH, basically they want to make sure that these organizations are not just money focused. Okay. So Department of Public Health, they work hard to protect the health of the nation, to make sure that every single one of these organizations are doing the right thing. Okay. So they protect the health of the nation. Back in 1987, the Department of Public Health created the Omnibus Budget Reconciliation Act, OBRA, of 1987. Okay, that was created by DPH. Now, as a student, you need to remember that Omnibus Budget Reconciliation Act of 1987 is always going to follow you around, not just in the classroom, but with the state exam. Okay, so OBRA improves the quality of life for people in long-term care facility. They make sure that they receive the best physical care, social, environmental, spiritual, emotional. So they make sure that the patient's room is clean, the patient receives the best of care, everything is a-okay. So that's why they created OBRA. Okay? And the Department of Public Health also created a system whereby on an annual basis and also on an as needed basis, they would perform a survey. Okay? They would perform a survey to look at what's going on with these organizations. So annually, every year, they perform a survey. They survey each facility to make sure that they are performing as they should and that the patient are receiving the proper care. And during the survey process, if an organization fails, well, guess what? You could be paying some fines, you could be in trouble, okay? And you might even lose the business, okay? Department of Public Health also created what we call OSHA to protect the healthcare worker, okay? To make sure that the healthcare worker receives all the equipment needed to provide the care necessary for the patient. They also make sure that the healthcare worker is not abused, okay? Is not given too much work, all right? So it's refreshing to know that the healthcare worker is also protected. Now again, healthcare organizations are running a business, so they have to get paid. How do they get paid? Well, the patient receives the service and the organization needs to get paid in order for them to stay in business. So the patient, client, or resident can do private pay out of pocket, okay? Sign a check, pull out some cash and pay. Private insurance, go across the street to the insurance company and buy an insurance policy. There's group policy. This is insurance that is purchased at a group rate by your employer or corporation. So basically when you get hired, they say, yeah, well, we got health insurance. Well, the health insurance you get from work, that's group insurance, okay? Medicare also plays an important role in paying for health care because Medicare is the type of insurance plan that is federally funded by Social Security under the administration of Medicare and Medicaid services, okay? So Medicare also pays for patient care, but to qualify, you have to be at least 65 years of age, okay? And Medicaid also pay for care, okay? Medicaid is federally funded and state regulated, okay? So Medicare federally funded and managed by federal, okay? Managed by the Center of Medicare and Medicaid. Medicaid is federally funded but managed by the state and is designed to help people with low income, the elderly, and the disabled. Okay? So that's how healthcare is paid for.